Hello everyone, to begin with the pathology series, we will begin with the chapter that is cell injury and adaptation. Cell injury and the adaptation. Cellular injury. So what is cellular injury? Cellular injury is a functional and morphological effect of the stress due to the variety of etiological agents onto the cell. It produces some changes onto the internal and external environment. So the cell will give some responses to the injury. The responses will be cellular adaptation. In cellular adaptation, cell may adapt by the hypertrophy, hyperplasia, atrophy or the metaplasia. Then second response of the cell will be cell injury. The cell injury occurring onto the cell will be reversible or the irreversible cellular injury. Then third response will be intracellular accumulation. Fourth is pathologic calcification. When the normal cell undergoes cellular injury, it will give two responses, that is reversible and the irreversible response. Reversible in the form of cellular swelling and the fatty change which lead to the normal cell. Then irreversible cellular injury may result into the necrosis or apoptosis which eventually lead to the cell death. If the normal cell undergoing the stress, it may adapt itself by following hypertrophy, hyperplasia, atrophy or the metaplasia. And if there is any stress withdrawal, the cell will become normal. And if the cell is not able to adapt, it may further lead to the cellular injury into the irreversible or reversible change. The causes of the cellular injury. The most common cause of the cellular injury is hypoxia, and most common cause of hypoxia is ischemia. Hypoxia refers to the inadequate oxygenation of the tissue, and ischemia means there is inadequate supply of the blood to the cell. Physiologic agents like mechanical trauma, thermal injury, radiation, electric shock and some pressure changes which causes cellular injury. Some chemical agents like toxins, drugs, hypertonic concentration, strong acids or alkalis and increased in the oxygen concentration. Toxins like arsenic and the cyanide. Then is the environmental and air pollutants, which also environment and the air pollutants like pesticides and insecticides or some herbicides. Industrial and occupational hazards. Then social or lifestyle choices like narcotic drugs, alcohol, smoking, infectious agents, immunologic reactions, maybe autoimmunity or anaphylactic reaction, genetic derangements, nutritional imbalances like excess or deficiency of some nutrients. Then aging, idiopathic means unknown cause. Then iatrogenic cause, which means owing to the physician. Example like include the untoward effects of administered therapy like drugs or radiation. The mechanism of the cellular injury. Hypoxia will result into the decrease in aerobic respiration, which decreases ATP synthesis in the mitochondria, and it will lead to adaptation. Cell will lead to adaptation which undergoes the reversible or irreversible change. Reversible change means the cell will get back to normal, and irreversible change means cell will lead to the necrosis or apoptosis, eventually leading to the cell death. There are two types of the cell injury, that is reversible injury, irreversible injury. Reversible injury means it is a stage of the cell injury during which the dearranged functions and morphology of the injured cell can return to the normal if some causative stimulus is removed. Under the light microscope, how will be the reversible change observed? It will be the cell will get swell or there will be some fatty changes. It is also called steatosis. The cellular swelling, microscopic appearance. Cellular swelling is a microscopic appearance under the microscope. It will undergo hydropic change. Cloudy swelling will be seen. Vacuolar degeneration. Also there will be disturbances in the protein, especially the albuminous degeneration, and water metabolism will be get disturbed. Then the causes of the cellular swelling will be mild injury, bacterial toxins, chemical poisons, malnutrition. The morphology of the cellular swelling will be in organs like kidney, liver, heart and the muscles. Then the gross appearance will be the organ will appear pale. Pale means light in color. Microscopy will be cellular swelling of the convoluted tubule of kidney is the best example. Will be the subcellular changes like endoplasmic reticulum. There will be distension of endoplasmic reticulum, especially the cisternae of the endoplasmic reticulum, and also the membrane bound polysomes will be get disaggregated. Then mitochondria will get swell, plasma membrane will form some blebs, and the nucleus will be undergoing some reversible injury. There will be granular nuclear constituents. Steatosis means the fatty change where there will be the abnormal accumulation of triglycerides within the cytosol of the parenchymal cells. The manifestation of the reversible cellular injury is a steatosis. Organs which are involved is mainly the liver, as in the case of the fatty liver, and some other organs like heart, skeletal muscles and kidney. Fatty liver, it is a most common site for the steatosis. Steatosis may be mild and reversible, severe and irreversible. Causes of the steatosis will be alcoholic abuse or some anoxia, anemia, cardiac failure, some toxins like CCl4, that is carbon tetrafluoride, and chloroform, Reye syndrome. Disorders like obesity, diabetes mellitus, congenital hyperlipidemia. Irreversible cellular injury will result into the cell death, that is apoptosis and necrosis. Mechanism of the cell death depends upon the nature of severity of the injury. There are two types of irreversible cellular injury, that is necrosis and apoptosis. Necrosis means it is always pathologic process, and apoptosis, it may be physiologic or the pathologic process.